Hello again, everybody, and welcome to this edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is, I'm so excited for this. I mean, I love talking to the doctors, of course, that we have with Monument. All of them have been fantastic on this podcast. But I wanted to, and I brought this up a while ago, I wanted to talk to a pharmacist because I think your job is fascinating, to say the least, right? So joining me is inpatient pharmacist with Monument Health, Alyssa Brunner. Welcome, Alyssa. Thanks for coming in.
Thank you, Mark. Good to be here.
Now, you're born and bred. You're from here, right?
Yes. Yep.
Okay.
Born and raised in Rapid City.
So how did your path end here? When you were a little girl in South Dakota, is this where you thought you'd end up?
Not right away. I did know starting in high school when it came to be decisions on where I wanted to go, maybe kind of wanted to be in the medical field. I always loved science and math. And I didn't want to go to all the school that the doctors go to.
Right.
So I had heard about pharmacy school, and it was a 6-year program. I went down to the University of Wyoming.
Is that long? I mean,
it is.
I can understand, I suppose. It needs to be, doesn't it?
Yes, yeah. And even some programs might require an undergrad bachelor's degree first.
Really?
And then an additional 4 years pharmacy school. So at University of Wyoming, I was able to do 2 years of undergrad and then not get a degree and then just go straight into pharmacy school.
Is there so much math involved?
Not as much math as I thought. More science, and a lot of the little chemistry is a big thing in pharmacy.
Well, what I think is so interesting about this is people are hearing the word pharmacy and pharmacist, and they're thinking, oh, well, yeah, it's like the ones when I go to in Walgreens and when I go to Safeway or when I go to Walmart. This is really not that at all. An inpatient pharmacist is something completely different, isn't it?
Yes, very different.
What are the differences in the two? We'll start there.
Okay. So for one, I rarely even touch a pill or medication most of my shifts that I work.
Really?
Yes, because I work more on the clinical side. So I work directly with providers and nurses and verifying medications that they enter on inpatients in the hospital. And then that electronically opens up a medication drawer in their automated dispensing cabinet, or the Omnicell is what we call it. And then the nurse is able to get it out and give it to the patient. So I rarely even actually touch medications unless we do have obviously a component where there are pharmacists that need to be in the main pharmacy, which is the hub that kind of dispenses all those medications to the machines.
You're in the hospital then?
Yes.
You're actually there. What's a typical day look like for you then?
So we have pharmacists on most of the different floors. So in the intensive care unit, pediatrics, just the regular medical floors.
How many are there? How many inpatient pharmacists are there?
I think we have 30.
Oh, my word. Okay.
Because we have to have 24-hour coverage.
Of course.
Yeah. So we have 2 pharmacists on our overnights, and then we have about 15 pharmacists throughout the day that come in at staggering times,
right,
to kind of give coverage at the busiest times.
Is it usually during the day is the busiest?
Yes.
Not at nighttime. Hopefully everybody's asleep and comfortable,
right,
and you don't have to worry about it as much.
The night is kind of putting out the fires of anybody who's kind of going downhill or any new patients that come in.
So you obviously then have to work really close with medical teams and doctors then, right? Is that kind of how that works?
Yep. So the doctors will put the orders in, and then we verify them. They come to us to verify. And we look at drug interactions, allergies, make sure they're dosed correctly for their age, their weight, their renal function, because there's so many different factors with everybody handles medications differently, and every medication is kind of processed in the body differently. So
you've got to handle situations then where things have to happen fast, or if there's changes in like patients' conditions, right? You've got to be able to jump on this immediately. Like after a surgery, is that a time when you might be more active? Should something start to go wrong or they need medication changes?
Yes.
Is that when you got to jump in and go?
Yeah. During a surgery, we'll get the post-op orders, and we have a pharmacist who's in the OR. They have a little office just right outside. They're not actually in the operating room, but
that's amazing.
They're right there. And so they prepare all the medications for the surgeries, and then they're usually the ones who get the immediate post-op orders. And then once they're stable, they go to the floor, and then depending on which floor they go to, then that pharmacist will take care of their orders. And so usually those are ones that we try to get to right away. And then also other emergency situations would be like a code blue, where a patient loses a pulse, and we are all ACLS certified. So pharmacists go, we're part of the code team, and we draw up the medications and give them to the nurses that need to administer them.
When you're watching a lot of the medical shows, you don't usually see the pharmacist.
No.
You guys don't get represented very well,
no,
apparently.
It really bothers me, to be honest.
I would be mad too, I suppose. But that's, so you guys, if a cold blue happens, you have to be there.
Yes.
So that's got to be scary and exciting and the whole thing.
It
right?
is. It's an adrenaline rush for sure. It's kind of nerve-wracking the first few times, but then the more you do it, the more comfortable you get with everything.
How long have you been doing this, Alyssa?
I have been a pharmacist since 2008.
Okay.
And then I did a 1-year residency down in Denver, which is not required, but if you want to be in the hospital setting, it's kind of, I guess it made me have a lot more confidence, just because there's so much more to learn that you don't really focus on in pharmacy school. So a residency is like a medical residency where you just get extra training on the job, but you kind of fall under the resident cloak to be able to still learn alongside your preceptors. And
so has there been a lot of changes even from the time you've started until now with the way that technology, I mean, in the medical field, it goes so fast.
Yes.
Have you seen a lot of stuff and advancements that you maybe never thought you would see? Are there things that just really make your job easier? Is there any examples of that you could give?
Yeah, so I definitely agree there has been a lot of advances in the technology. When I was first doing my rotations, which we do during our last year of pharmacy school, we spend a month or 6 weeks in a different setting to kind of see where we want to be. And so at some of the hospitals I was at, they were still using, most of them were still using paper charts. And then some of them, depending on how advanced they were either scanning them into the computer, and then they'd come on a screen for us to try to decode the handwriting of the doctors,
of course,
which was difficult. That should have been a class on its own, but some of them were also still having just a basket on the counter, and the pharmacist would have to go around like every 30 minutes or hour and collect like duplicate copies of the handwritten orders. So that has come a long way now that doctors are actually entering their own orders. And
that immediacy has to make, I mean, it has to literally be life-saving in some instances.
Yeah.
Walking around 30 minutes to an hour to collect these things, and now I'm assuming they pop up on a screen for you.
Right.
And you're ready to go.
Yeah, exactly.
Well, you mentioned something earlier when we were talking about, you said a word that I didn't know, which is where the medicine is dispensed from.
The Omnicell?
Yeah, what is that?
Yes. So I kind of describe it to people who've never seen it before, like a vending machine. So it's got 20 some drawers, and then in each drawer there's 20 pockets, and then they're all electronic coded so that once a nurse goes in there and pulls up her patient and then selects the medications that she wants to give to her patient, then it will only open those particular pockets it's a safety thing.
Yeah, of course.
So then those are barcoded, and the nurse will take that, scan the patient's wristband, scan the medication, make sure that it's all being given to the right person.
So was that scanning a thing back when you started in 2008, 2009? I know, because you go in now, you get the wristbands. They're constantly asking you, birth date, name, and then you get scanned.
Right.
How recent is that? Do you know? I mean, how long they've been using that?
I don't know. I think the scanning has been around maybe longer than the actual what I was talking about with the paper charts and everything. I think that's been kind of a safety issue for a while, but I couldn't tell you for sure.
Now, the Omnicell, that also has had to reduce instances of mistakes with medication too, you would think.
Yes.
Is that true?
Yes, it is. Not to say that mistakes still can't happen. We have a bunch of amazing technicians that they will pull the medications that need to be refilled for the Omnicell, and then there's a pharmacist down in the main pharmacy who checks those. And that's just all a visual check. Obviously, like when we're returning medications, usually is when it happens. They could get put back in the wrong bin, and then if a tech is just taking, 20 Tylenol, then there may have accidentally been something else thrown in there,
Right.
and you're not really seeing that because there's so many of them. You're just kind of scanning through them when you're checking them. So that's sometimes we find medications in the wrong bin, but then hopefully that should get caught when the nurse is going to scan it in the patient's on the patient's wristband.
There's just lots of fail safes, it seemed like, is in this system for sure.
Yeah, there are.
So do you work pretty closely with all of the other 29 inpatient pharmacists that are there? Or do you really have your own area and that's what you cover? Is there a specialty in this? Or
So there are kind of some pharmacists who only work in pediatrics. We have about 3 because it's so specialized. And so they were trained however long they've been working there, they've kind of started training and now they know it so well. And for anybody else to go into that area, it's difficult.
Right.
Now, they're not always on like overnight, so we all have to have a little bit of that knowledge and tons of documents that we have available online if we need any help, if things come up after hours. And then the OR is another specialty area. And the ICU, those are kind of our 3 main ones that not everybody will rotate through.
Sure.
But all the other medical floors like the med surg and ortho-neuro surgical floors, pretty much any pharmacist can kind of rotate through there.
I'm so surprised that there's so many. It's really good to know though. I've only ever had to be overnight in a hospital one time.
That's
good.
And
I was wondering, how do they know? How do they get the medication so fast? I don't know why I wasn't thinking, well, probably because you just had surgery, but
right.
You're not thinking that the pharmacy is right here and all the medication is right here. It all has to be right here. You guys aren't running out to Walgreens or hurry up, somebody get in the car and get these pills over here.
Right.
Is it, do you find this to be pretty rewarding, though? Do you really like doing this? It seems like you have to.
Yeah, I really do. I enjoy my job. It's always something different. You always come up with new challenges, and our doctors come up with questions or a weird reaction, and you got to figure out what drug could be causing it. So I really do enjoy.
Oh, that's another thing. I guess it's in a lot of instances, it's not the doctors that are figuring that out. It's you.
Right.
You're the one that has to be like, well, wait a minute. If this didn't work or this happened, here's the medication that did it, I suppose.
Yes. Yeah. They're the ones who they're seeing the patients. We don't see a lot of patients physically either. So they're the ones who are recognizing these problems and then coming to us saying, could this be one of the drugs? And sometimes it is, sometimes it's not. Sometimes it's just a reaction or a side effect of their actual illness.
So what, moving forward, are there any technologies that are going to change your field some that you might be getting excited for? Do you ever get to see kind of into the future a little bit through, I don't know, like conventions or whatever for pharmacists that exist? Is there anything that looks exciting to you coming down the pike?
I don't know that
I've really seen anything like that?
Yeah.
When are the robots just going to go around and start dispensing?
Well, that is something I am a little concerned about at some point, but
I don't think like AI, do you worry about that at all as a pharmacist or not worry? Is it a tool that you guys use or will use, do you think?
I don't worry about it overtaking us. We use there's a lot of in our software.
Yeah.
There's a lot of interaction checking and allergy alerts and things that pop up. So that helps us with our job. But also you have to have some degree of clinical judgment to be able to know if that's appropriate. We get so many warnings when we're verifying these medications that aren't necessarily relevant. They're just kind of there to maybe spark something in your brain like, hey, this could be a problem, like dig into it a little deeper. So in that sense, I guess we're already doing some of that, but I suppose there could be more with AI at some point.
How many new medications come out every year that you constantly have to be on the lookout for? Is there like an average amount that happens in new stuff that you're like, oh boy, I better figure out how this interacts with this?
Right. Yeah, I don't have an exact number, but there are a ton more that come out that, especially like maybe as a retail pharmacist, they might see them more because the new diabetes medications or blood pressure or any of those. And we kind of have a set formulary where we, just because of cost savings, we use what we've always used, what's going to be the cheapest, but also has evidence for being the most effective in patients. So, but we'll see patients who come in on these medications from home, and then I have to look it up and see, what is this?
That was going to be my next question. Has there ever been one that surprised you? A medication that's come in and you're like, I'm not sure I know what this is.
Yes. Yeah.
Really?
Yep, there is. We do CE like doctors do, every year, but there's only so much CE or you can't cover all of the new medications that are coming out. So.
That's amazing. Well, this has been fun talking to you, Alyssa.
Yeah, you too,
I'm really glad you came in. You're an inpatient pharmacist with Monument Health. You and everybody's there. I'm just so happy to know that you're there right now. That there's so many of you, honestly.
Well, thank you.
Yeah, you bet. So thank you for coming in and talk, Alyssa. I really appreciate it.
Yes, thank you for having me.
You bet.